Hi, my name is Brianna, and I'm going to be doing my project on. Okay, so strokes, they're a major problem all over the world. It's an emergency that can come out into severe damage to your brain or even death. Each year, thousands of people suffer from a stroke. It's one of the third leading causes of death over the world. Only heart disease and cancer can kill more people than stroke, but strokes are fatal. But the people who survive their first stroke will gain some of the lost brain function that they've had. Additional info. Most stroke victims are usually 65 or older. Um, TIA, or cerebral disorder, is another name for stroke. TIA is transient ischemic attack. TIA is basically when an amount, small or large, amount of blood does not get to the brain, and that does not get to the brain when does not get to the brain or when the artery erupts and causes a stroke. The bleeding causes swelling that can damage the brain tissue. This is the leading cause to a stroke. Causes. Most strokes occur when a blood clot blocks the flow of blood to the brain. The clot blocks the nutrients and oxygen and blood for the brain to have. Those are three main things that the brain needs to have to be able to function. Permanent damage, which damage is stroke, can occur if the blockage cannot be opened in a matter of minutes. Heart disease, or like the irregular beating of the heart, like it goes doo doo and then like doo doo or something like that. It can lead to atherosclerosis, and basically what that is, it's the hardening of the arteries. So the arteries get really hard, and it's hard for blood to go through because the blood goes really fast. Continue cause. If the artery walls clog, it clog basically it's waste in right there that builds up. So the blood is not able to move efficiently in a moving flow, therefore causing a blood clot. And the blood clot can get so big and tense that it can actually erupt, and the rupture is lack of oxygen, therefore to the brain, causing a stroke. Another major cause of a stroke can be cerebral damage. Cerebral damage is basically the brain tissue is damaged. So it's the so of the eruption of the regular circulation. Therefore, the victim suffers a stroke. So a main artery, a vein, a main artery or vein, exposed, or like a clot, a rupture, or a clot that can't get by at all, or even the thickening of the artery walls and even high cholesterol can all be the factors of you having a stroke. Signs and symptoms. To the right, you see a picture of a vessel in the brain, a vein in the brain, rupturing, and therefore it's bleeding out, causing it to swell, and the pressure of the blood causes the brain tissue to have damage. The most common stroke symptoms are loss of sensation of the body, uh, you lose your balance, loss of vision. You can't really understand others. You can't speak. Your words are slurred. Your face is kind of like, it's not falling, but it's kind of like sagging. Like on one side, it's sagging. Your arms and legs get very numb, and you can even have like your limbs, like you can't really like control your limbs, like you won't like reflex like slap somebody in the face, but it's like you can't really coordinate and like move your arms or legs. Treatment and therapy. Stroke treatment must be given within 3 hours within the stroke. Must be given 3 hours within the stroke. For the treatment and therapy. Stroke treatment must be given 3 hours within a stroke. For this treatment, it has to open the clog of the clog or the rupture, clean up the rupture, suture the rupture, or whatever it is, whether it's a rupture or a blockage or whatever it is. Prevention. The doctor can, your physician can give you an aspirin, or I think there's another kind of medicine. It will basically what it does, it will thin your blood, so your blood won't be easier to clot. Cause blood clots also have enough like really thick blood. People with author ATAL can get a surgery on like, if the artery is big enough, to get the waste or the goop out of the artery so the blood can continue a steady flow. Also, to keep, if you do have cholesterol, to keep a low cholesterol, because that can also be a factor of a stroke. Here is a blood clot, basically waste or food that is blocking the blood from being able to get to the brain or neck. These are a couple of things that you want to avoid having: high blood pressure, abdominal obesity, which is abdominal means to be overweight, of course. To be like tobacco, to smoke tobacco, smoking in general, to have diabetes, even heart disease and irregular fibrillation of the heart, and high blood pressure. Continue prevention. Aspirin and anticoagulants can help lower high cholesterol. Doctors can also do an operation where they put in like, it's kind of like this squishy thing, and they put in like a stent to open the clot so the blood can continue a steady flow. Carotid arteries in the neck can also cause a stroke, so, and even death. That's another leading cause. So internal bleeding is really bad because it damages all the organs in your body. So if you bled in the neck, you would either die from the severe bleeding internally and not be able to breathe because you're choking on blood, or you could either die if it wasn't that big of a rupture of it not getting to your brain, and you probably getting dizzy of not enough oxygen, collapsing, falling down. Then you're getting symptoms of a stroke, and then if it's not opened, like I said, a stroke. And also you can prevent it by eating right and having a low blood sugar. Yeah, your doctors do a couple of tests actually. They can do physical examination, blood test, computerized tomography scan, MRI, carotid ultrasound, cerebral angiogram, and an echocardiogram. Continue diagnosis. Blood tests will include how fast your blood and levels of sugar, and levels like how fast your blood can clot and your levels of sugar. A computerized tomography scan will show a picture of your brain. MRI will use waves to see very detailed images for transoxic attack, which is another name for stroke or cerebral disorder. A carotid ultrasound will use sound waves. Will use sound to show a detailed image of your neck arteries. Continue diagnosis. So, cerebral angiogram uses a dye so when they take an X-ray, you can see the arteries. An echocardiogram uses sound waves to see a digital image of your heart. These are the most common diagnoses for stroke, and examination may vary according to the symptoms.